The Center for Human Development is a nonprofit organization delivering a broad array of critical social and mental health services to more than 18,000 people each year right here in Western Massachusetts and in Connecticut. Recently, I sat down with CHD's Vice President of the Office of Development, Kim Lee, to learn more.
CHD is the Center for Human Development. We are a very large not-for-profit organization located throughout Western Massachusetts, but we're also in Franklin County, Berkshire County, as well as in Connecticut, down in New Haven County, Litchfield County, really pretty much all of Western Massachusetts, and then into northern and into central Connecticut.
And what kind of services do you offer?
We have just about 70 different programs and services that are provided to children and families, to adolescents and teens, as well as to senior citizens, older adults, individuals. But we predominantly provide anything from mental health services to housing for the homeless, stabilization services for the homeless. We provide intensive foster care, therapy for families who might need some additional mental health supports, who might have behavior management issues with their children or with the young people in their lives. But if it's a service or a program that you may need, chances are CHD provides it, or we can certainly help you find another provider in the community who has what you need.
And you spoke about mental health, and that is such a big issue in society, and yet it's also such a touchy subject. How do you help people in that area, whether it's alcohol abuse or depression? How are you helping people?
And that's a great question, Carol. Actually, it is Mental Health Awareness Month right now, and so the question is extremely relevant. And you are right, for the number of young people, the number of adults who are actually affected by mental health issues or illness, it is still very much a taboo subject. It takes a lot for an individual, it takes a lot for a parent to admit that a child, that a family member may have a concern or may have a mental illness. And so CHD really does work very, very hard to make it as comfortable as possible for families, for individuals to come forward and to get the help they need. It is interesting in that with so many of our services working to support the needs of adults with mental illness, overwhelmingly what we hear is, I'm not expecting you to necessarily fix me, I just want you to understand me. And so that really is a large part of the type of work that we do with families or individuals who are afflicted by a mental illness.
And you also work as well, you mentioned children who are in foster care. How do you help support them?
We do. We have an intensive foster care program actually located over in West Springfield, and we help children to find their forever family. So for a lot of reasons, whether it's substance abuse or perhaps mental illness, there are children who are removed from their biological parents' homes, and our job at CHD is to find those foster care placements, to find families that are loving, extremely compassionate, and willing to take a child into their home who isn't necessarily biologically theirs. And there are, thankfully, so many families in our community who are willing to step forward, but with such an extensive wait list, not just in Springfield and in Hampden County, but really throughout the state, the Commonwealth, where there are always room for additional families who would be interested in providing a home, a safe landing for so many children in our community. And
you are a nonprofit. Tell me about your fundraising and how you're funded.
We are a nonprofit, and it's interesting, Carolee, because people will look at the size of CHD, and we are a very large nonprofit, but 99% of our funding actually comes from state contracts or from very prescriptive government funding, which means the programs that they're funded by or with leave very little discretionary money to be used for programs like our Cancer House of Hope or for disability resources. So we're continually looking for new sources of revenue, looking for contributions and for donors to support the work that we do that supports programs that aren't funded through those government contracts.
And how do you support the Cancer House of Hope?
The Cancer House of Hope is a wonderful program that's located in West Springfield. Very, very unique programming in that we work with cancer patients, those who have either been very recently diagnosed or who might be in a different stage of their cancer, but who just need a place to go that's not institutionalized, that's not medical, that's comfortable, that's quiet, that's compassionate, and that's very, very understanding and sensitive to the battle and to the struggle that not only the patients themselves are going through, but their families as well.
So you're also able to support them, the families as well in that?
We are. A big part of what the work of the Cancer House of Hope does is really to focus on the needs of the family as well as the individual needs of those who are struggling with cancer.
So you have a few events coming up this summer. What can people look forward to?
We do. We have a wonderful program up in Amherst called Not Bread Alone, which is a community feeding program. And we have our annual appeal that will soon be hitting mailboxes in Amherst, and we just ask people to be as generous as they can to the important work up in Amherst. And then we have another program, event, Light Up the Night, which also happens in Amherst, and it is a fundraiser for another CHD program called Family Outreach of Amherst. And it is a wonderful event, happens outdoors, under the lights, and it's just a wonderful, again, opportunity or chance to support the good and important work of CHD.
All right. Kim Lee, thank you so much for joining us.
Thank you, Carolee.